I'm Daisy Barker, and this is my documentary called The Acne Agenda, What Social Media Doesn't Tell You, where I'm going to be talking all things skincare and acne. So let's go. What is acne? So, acne is a skin condition where your pores get blocked with excess oil, dead skin cells, and bacteria, and it then forms stuff like blackheads, whiteheads, and pimples. Now, the most common place that you get acne can be your face, your chest, and your back, and it's most common during puberty, but that doesn't mean that you can't get it at all ages. I started getting acne at the age of 12, and I went straight over to social media and I followed viral skincare products and viral skincare trends, which in the long run definitely made my skin way worse, which is something that is currently happening with the viral skincare brand Drunk Elephant. It has gone very viral all over TikTok and social media due to its bright, colourful packaging and sleek design. However, there's been lots of articles, as you can see from around me, where young kids and teenagers have used some of these products without knowing how strong they are and how damaging it can be for their skin. For example, they've used products like retinol oil and retinol cream, which is okay to use, but when you overlay with too many products, it can end up damaging your skin barrier. A broken skin barrier looks like burning, peeling, and redness, and it can be because of combining too many intense and harsh products on your skin. Now, this is something that's gone viral on TikTok because a lot of people do a 10-15 step skincare routine, which is very extravagant and is not always the best thing to do for your acne. This is why it's important to always speak to dermatologists and doctors and to not always follow things that you see on social media. This is why I've taken it upon myself to speak to aesthetic nurse practitioner Julia Downton and skincare dermatologist consultant Dr. Fatima to ask them questions about everything skincare, acne, and treatments. Here we are now outside of Riverside Skin and Laser Clinic, and we're going to go speak to Julia Downton and Dr. Fatima. So let's go.
So in room 1,
Yeah.
this is where we do most of our body contouring with this machine here.
Wow.
And then we have in here all of our chemical peel products
It's very organised.
and hydrofacial products. There's a list on the wall here, look, which we have to do a stock check. These are all locked because these obviously need to be locked away because they're chemicals and they go in a key safe at the end of the day. Room 2, this is where we do consultations here for skin consultations.
Yeah.
And then we have here a skin scanner.
Oh.
And this scans your face, it's 3D, and we can show patients their skin and underneath the skin for things such as large pores, rosacea, acne, and we can show the clients what their skin will look like in 5 to 10 years' time. And then we have obviously our couches here, and over this side, this is lockable as well because this has our emergency drugs and needles and things in there.
Yeah.
This is our hydrofacial machine.
Mm-hmm.
We have, so this is just like a lovely facial to clear the skin. It just gives you a lovely glow and no downtime, so people can have this before an event.
So it's relaxing.
This is more relaxing. It takes about an hour.
Okay.
And then this is Dermaforce, and we have on this we put a handpiece, and it has 36 needles for the face and 64 needles for the body. And so at the tip of the needle, so it's microneedling, but at the tip of the needle we have radio frequency, and that helps for skin tightening. And we'll probably discuss that later, won't we, in the interviews. And then this is HIFU, and so this uses ultrasound.
Yeah. Oh, okay.
And it's good for face, so Dermaforce tightens, HIFU lifts, so face, and just small areas of the body because you only move the handpiece a millimetre at a time, so it's quite a long treatment for large body areas.
There's so much high-tech stuff in here that I didn't even know existed.
And then I'll show you our laser room in here. So when we switch this on, obviously it says laser in use for safety, so no one enters, because when you're doing laser you must wear goggles.
Okay.
And obviously the client wears goggles and the practitioner does, but obviously if anyone comes in and the laser goes off, it's not good for your eyes.
No.
So this is really bright, this room.
Yeah.
Because it has to be, so that you can see things like broken capillaries. And we do CO2 laser, we do skin resurfacing, and this helps obviously with pigmentation, rosacea, and obviously just skin resurfacing, which gives you a lovely complexion.
Does laser hurt when you do it on the skin?
Laser, so I've had laser for broken capillaries on my cheeks,
Yeah.
and it hurts a little bit, so it's not a pain-free procedure.
Yeah.
But it's not too bad, it's bearable because the results are so good.
Okay, so it's
And
worth
so
it.
it's worth it. So literally you have the goggles on, but you do kind of see a little flash, and then you have it's like a pinch,
Okay.
and then it's over, and then I kind of giggle because
Yeah.
I know it's coming, but every time I jump.
Yeah.
Yeah, so really good machinery in here.
Wow.
Hello, I'm Julia, aesthetic nurse practitioner here at Riverside Skin and Laser Clinic. I think the most common misconception is that people feel that it's caused by maybe poor hygiene or not cleaning their skin properly. And then what happens is people over exfoliate, over scrub, and then cause more damage to their skin. You can look for products containing benzoyl peroxide, which help kill the acne bacteria, or salicylic acid, which helps with removing dead skin cells and unclogging pores for a better complexion. We use a lot of medical grade skincare products in the clinic. We use products like Mesoaesthetic and Obagi, which are proven and have lots of trials, and they're proven to work. Avoid over oily products, so stick to water-based products which aren't going to clog the pores and clog your sebaceous glands. So I would say the first thing is not to pick. The more you pick, the more you can spread bacteria. You can actually push bacteria deeper into the skin. And obviously when you cause trauma to the skin, that's when you get more pigmentation because you are stimulating your melanocytes.
Walk us through how you choose between treatments like chemical pills, dermaforce, or injectables for a patient.
So chemical pills are great for certain things such as pigmentation and acne. Some people love chemical pills because sometimes you peel, so you only peel if your skin needs to peel. And obviously it depends on what depth of peel and what strength of peel. But mostly the pills we use, you can carry on with your daily activities that afternoon or the day after. Dermaforce is great for people who would like skin tightening. So Dermaforce uses, for the face, 36 needles, and for the body, 64 needles. And those needles are used for microneedling. And at the tip of the microneedling tip, it produces radio frequency, and radio frequency goes into your skin depth, which causes skin tightening. So that's great if you want sort of tighter skin in jowls or neck area. And injectables, we always say skin first, injectables second. So injectables are for those clients who maybe have tried skin procedures and they've got very good skin and they maybe would like to try injectables.
And is dermaforce painful? I know you said it has a lot of needles, so is it a painful experience?
No, clients tolerate it really, really well. So yes, all procedures have a certain amount of discomfort, but our clients tolerate it really well, and we can always use numbing cream if required.
What skincare advice do you wish more people followed?
Sticking to their skincare routine. So a lot of people tend to buy lots of products and use different products every night. And generally, if you need to stick to a routine for a minimum of 28 days, because your skin cell turnover is 28 days and it does increase as we age. So people need to stick to a routine, and particularly if they've got a skin condition, they need to stick to that for a good 12 weeks and wait for the results, because they will come, it just takes time. A 10 steps routine is way too much for people. How are people with busy lives going to stick to that? I certainly couldn't. The main thing is to have a small routine that works for you. And also, not all skin products suit everybody. So these products that are promoted online or on social platforms aren't good for everybody, and therefore people can damage their skin.
Do you think that social media creates unrealistic expectations around skin health and treatment results?
Yes, I mean, at the moment I think there's a lot about glass skin online, which is really difficult to achieve, and everybody's skin is different. And also with the use of things like filters and AI, quite often people don't have this perfect glass skin, very rarely actually, and so people are aiming for something that's very difficult to achieve.
Are there any specific trends or ingredients going viral that you would caution people to avoid?
I think anything that goes viral, there's not research behind it. So yes, I think certain things you just need to avoid, and you don't need to listen to influencers. Again, you just need to see somebody who's going to be knowledgeable about skin and be acting in your best interests.
What's your favourite like treatment that you do on a patient? Is there one that you particularly enjoy the most?
We do. I offer cryotherapy, which I think is makes a huge difference for people. So we use a cryo pen, and we can remove lesions. And recently, I've removed skin tags on people's eyelids or skin tags over the body, and it really does affect the patient. So that's quite rewarding because it does change people's lives, particularly when they have lots of them all over their body and they're worried about taking their shirts off to sunbathe or be on holiday, and they say remain covered up. So I enjoy doing that because it makes such a difference to people's lives. But I enjoy all the treatments here, and every day is different, meeting lots of different people.
So what are you doing now? What are you showing me?
I'm going to show you the HIFU machine.
Okay.
So we need some gel, and actually I'll use a spatula. And obviously with all treatments we would wear our gloves and apron.
Yeah.
So I'll put some gloves on. So HIFU is the one that lifts the skin,
Okay.
and it uses high intensity focused ultrasound, HIFU. So you can hear the handpiece.
Yeah.
So we have to place a cartridge. So this is a face one. It's very important with face and body, so you write on every box
Oh, so you know which is which.
which is which. So you can hear it. It's on standby at the moment. These cartridges do 10,000 shots.
Wow.
So 10,000 applicators. And at the minute we've got 7,160 left on this cartridge.
What is that picture?
This shows you the skin layers here.
Ah.
So we need some gel,
Yeah.
which I'll pop on there. And then what happens is you can test it. I'm trying to put lots of gel so you can see it fire.
Yeah.
So when I press this, let's turn it up a bit so it really fires. And you can test it by pressing this button, and you can see the gel splatter.
Oh,
Can
wow.
you see?
Oh wow.
And
yeah.
that there is the ultrasound coming out of the cartridge.
Wow. That is really cool. Wait, so what is this used for again?
So this is for skin tightening, so we will use it on the face
Oh. Yeah.
in different areas.
Wow, I've never seen anything like this. I'm really in awe. You show me
That's
everything.
really
It's
good.
really cool.
So that's that one. We can also test it on, if I can find it, I generally have, it's over this side, a piece of Perspex. Now, if you, for example, if you feel this side it's really rough,
Yeah.
and if you feel that side it's smoother on this one. So that there, the rough bit,
Oh,
that's
yeah.
the damage that's caused under the skin, and where it's smooth, it's where it doesn't affect the skin at all.
Oh.
So we can test this as well. And if I put it on an area that hasn't been tested on before, if I press ready, it would work. Okay. And you can see there's a bit of damage there.
Oh wow.
Yeah. So that's how that works.
That is amazing.
So I always get used to put it on standby all the time, obviously,
Yeah.
because you just don't want to keep firing it when you don't need to.
Thanks for showing me this.
You're welcome.
Hello, I'm Dr. Fatima Odi, consultant dermatologist, and I'm the owner of Riverside Skin and Laser Clinic. Acne is caused by overproduction of oil from one of the glands that we call sebaceous gland. These glands can be sensitive and due to the hormones, even with normal hormonal level in the blood, can make these glands to be overactive. Acne can be genetic, so I see so many of my patients that they have a family history of acne. However, it can be hormonal or even like the lifestyle can play an important role, like stress, skin care products, and diet.
What are some of the most common skincare mistakes people make?
So most of the time, my patients come to me very late as they try so many over-the-counter products which doesn't help, and they try so many things that is not as advised by a professional. And unfortunately, by doing this, that can delay their acne treatment. And this is what makes our job more difficult, because even though we can treat acne by medical treatment, but then they will end up with the scars that we treat in Riverside with the CO2 laser, but that can be even harder and more expensive treatment.
Are expensive skincare products worth the investment, or are drugstore brands just as effective?
So it's very important for everyone to know what skin type they have, because by doing this, then they can determine what type of product they use. I don't usually advise to go with expensive product, is to go the best advice. So it's very important to stick with a good skincare, including very good SPF that cover a wide band UVA and UVB, to have a good moisturizer that doesn't have lots of perfumes and active ingredients that can irritate the skin. And I always advise to, for example, if they have a mild acne, to stick with a topical treatment like has a benzoyl peroxide in it, or even adapalene or tretinoin.
How does skin types like oily, dry, combination, and sensitive influence what kind of products someone should use?
Yes, so it's very important if someone has acne to know what type of skin they have, because as we said, the oily skin, that's tend where the best environment for the bacteria to multiply and to create pimples, blackheads, and whiteheads. So that's when we say that if it's oily, they need to go with a water-based skin care product. It has to have the label non-comedogenic in it. That means that they don't block the pores and make the problem worse. It's very important to know what type of skin you have, and we offer wide values of chemical peel. We offer this when it's a mild acne scars, or even just as simple as hyperpigmentation. We offer skin prescription-based skin care that works on the discoloration on the skin with a very good outcome. Stress been proven to be one of the elements that makes acne worse. And what I tend to see from my patients, that because their acne gets better, they feel much happier and they feel much more confident on themselves. So, and that's why we are very careful, because even when we prescribe the isotretinoin, which is one of the best treatment for acne, that's there's some link between this medication and depression and mental health. But what I see from my patient, that once their acne is better, they feel much happier. We do work closely with psychiatrists in order to assess, if we need to, in order to assess their mood and to make sure that it's safe for us to prescribe this medication. And we work on them very closely in order to assess their mood in every visit, to make sure that our treatment is working well.
Have you treated patients who have damaged their skin from following influencer advice or using unregulated products?
Unfortunately, this is when I see so many of my patients who they don't see the right people early in their journey. They then end up with so many like hyperpigmentation of not using the right product on their skin, or even by doing the wrong treatment, which they end up with even more severe scars. I always try to like educate my patient in a way that it's a long journey. It's not going to be one day thing, and most of them they understand fully from the first consultation that they are going to be very happy at the end of the treatment, but it takes a couple of months to have the result that they are looking for.
I've decided to create a vox pop, and I spoke to the students of Global Academy to ask them a question about acne and whether they pop their pimples or they just let them be, and here is what they had to say.
I let my pimples be because I feel like popping them will make them worse and make them spread, so I just like leave it and let it go away on its own.
I pop and squeeze my pimples purely out of habit. It's probably not best for health, but I just do it.
I pop and squeeze my pimples. I try not to, but I do. It's a force of habit, really. I don't know why, but I do.
I'm guilty of squeezing my pimples because it's satisfying.
Okay, I'd rather pop my spots if it's a whitehead because I don't like the white on my face.
I leave them because I don't want to get my face scarred.
No, I do not pop my pimples because I don't want scars on my face.
Yeah, I sometimes I pop my pimples and sometimes I don't. Depends on how bad they are.
I'm Daisy Barker, and that was the Acne Agenda.